Joshua Youngs with Medicare Peace of Mind, talking about what is Part B, as in Bravo or boy, or Part B. With Medicare Part B, that's going to be your outpatient services. Could be the doctor office visit, could be an outpatient surgery, could be any kind of outpatient imaging, x-rays, CAT scans, CT scans, MRIs, all that kind of stuff is done outpatient. Your medical supplies, oxygen, wheelchairs, durable medical equipment, prosthetics, all fall under Part B as well as anything that's administered by a medical professional. So it could be at the provider's office where they hand you a pill, put it in your hand, put it in your mouth. If they inject it into your arm, any kind of thing like that is going to fall under Part B. And Part B, coverage-wise, has a $203 deductible for 2021. After that, it goes to 80-20, where 80% is covered by Medicare, 20% is covered by you or your other coverage if you get a Medigap or Medicare supplement plan that covers that co-insurance from Part B. And so you have those exposure points. As far as what is Part B is a whole litany of different things. Part B offers your chemotherapy, cancer treatment outpatient, covers dialysis you're done on an outpatient basis. In essence, most things in today's medical environment are going to fall under a Part B umbrella. Again, Part A is going to cover your inpatient. Your Part B is going to cover all of your outpatient services. And so it's a good idea when you have Part B and Part A involved. Anytime you have Medicare, it's going to be a potentially high dollar ticket item. I would always have a pre-authorization run to get a good idea of what is Medicare going to cover, what is my Medicare supplement, if I have one, going to cover, what am I going to be responsible for on the best educated guess type of scenario possible. There's no guarantees. There can always be complications or changes to things as you get into things and figure out complications as you go. But you can get a good idea of a snapshot of an idea of what the cost should be. And that's a good thing to have as you go through and navigate Part B expenses. Some of them can be low, some of them can be pretty high, like cancer treatment, chemotherapy, 80-20, when you're paying 20% of chemotherapy, that can add up pretty quickly. And with Part B, there is no limit. There's no max out of pocket, so there's no limit on the exposure that you could have. If you end up with $1 million approved, $1 million of Medicare approved charges, you'll end up having to pay 20% or $200,000. So it could be a bankruptcy event for a lot of folks if you don't have the right coverages in place. So again, most people don't stay with just Part A and Part B. They'll either get a Medicare supplement to fill in the gaps of Part A and Part B, or most or some or all. That depends on which plan you get. Then you have Medicare Advantage, which has A, B, and usually your drug coverage built into one plan with additional benefits as well. And so there's some strengths and weaknesses to every option, including original Medicare. It's important that you understand when they rolled Medicare out in 1965, Medicare was never designed to cover 100% of your costs. It was really just designed to give people that 80-20 model, where a lot of people that were retiring had no option for health insurance. And up until January of 2006, there was no option for prescription coverage as well on a standalone basis with Medicare. There was a few Medicare supplement plans that would offer some type of hybrid type of prescription drug coverage. But again, Part B, in its formality when it was created, is created on an 80-20 model with a deductible up front. The deductible is a one-time per year, calendar year deductible. So once you've met that with a combination of one or more visits, you were then, in essence, satisfy the deductible for the rest of the year, and you go into co-insurance of 80-20. Thank you for watching. If you have any questions, we hope you reach out to us. And otherwise, we hope that you'll watch another video very soon. Thank you. Have a great day.